My whole body hurt, my stomach hurt, and there was not even anything to throw up anymore. And I was laying in the hospital bed of emergency at the Royal Adelaide, and I said to my partner, you know, I feel so sick that I think I might die.
My mum got sick quite suddenly and actually died within a couple of months of a pancreatic cancer. That certainly deepened my whole understanding of what it meant to go through cancer treatment.
I'm more than my illness. I'm not just the girl who's a terminal diagnosis. I'm not just the girl who's in palliative care. I'm Annalise Holland, and I like to do normal activities, and I think people should be seen as that, not just their diagnosis. We're more than that.
I was 23 years old when I was diagnosed with C. diff. It was just a really unlucky event. C. diff was described to me as being an infection of my large intestine, where a bad bacteria had basically overproduced and was wiping out the good bacteria in my gut, and therefore my large intestine wasn't able to do what it's meant to do. Flat, exhausted, the worst stomach pain I've ever had in my whole life, vomiting, diarrhea. There were times that I couldn't even get up off the bathroom floor to make it back to my bed. I couldn't go to work. I was in and out of hospital. I think I've counted 7 times. Everyone else in your life becomes really worried and upset. So it wasn't just me impacted, it was everyone. The doctor explained to me that they were going to take someone else's feces, blend it up with some saline, and then put it into my large intestine, and that would fix me. How that works, I will never understand, but within 48 hours, all my symptoms had resolved. And I went from feeling so bad to just feeling great. And it's like it never happened. It's like it never even happened, which is unbelievable.
During my time as an intern, I worked on a radiation oncology unit at the Royal Adelaide. Only about 6 months into that, my mum got sick quite suddenly and actually died within a couple of months of a pancreatic cancer. And so then I was able probably to reflect more deeply on cancer care and then ultimately palliative care. Proton therapy, that's an enormous investment. It's a national centre. That's not the sort of thing, unfortunately, you can have in every country town. So then it's how do we make sure everybody gets access to it. The hospital research funded team has been amazing that you're sponsoring 10 or 12 of our world-leading cancer physicians, radiation therapists, physicists, experts in patient journey, wellness. All of those people are coming together to deliver something pretty amazing. We want to just keep striving to say everybody, doesn't matter where they live, has access to the fantastic care that we can give.
I have a disease called AAG, which is called autoimmune autonomic gangliopathy. It's basically a disease that creates antibodies that attack my nervous system. I've lost majority of my bowel. I have a stoma bag. I'm actually unable to eat, so I haven't eaten in about 6 years. It can be very isolating, and I'm so thankful that it keeps me alive. I kind of hid my disease for 9 years because I didn't want people to see me how I was now. I wanted people to remember me how I was. And it wasn't until I spoke out, which was when I did the City to Bay run, that I realised that there was help out there, there was people out there. I started thinking about my legacy, and I remember crying in hospice one day to my mum saying, if I had a funeral, no one would attend because no one would know. I don't want to take my story to the grave, and if I can at least help one person, then that's what I set out to do. Palliative care and hospice is about being home, and I owe that to palliative care because I'm not better at all. It just allowed me to be home, and it's allowed me to be with my family, with my pets, in the comfort of my own things, rather than talking about dying. I think it's about celebrating the life that you've lived. So yeah, it's hard to not cry because I'm really thankful for everybody. Yeah. Like I say, it's happy tears, not sad tears. Yeah.
Today I'm here because of the amazing research and the doctors that we have access to. I think the future doesn't have limits for these things. And for me, if I didn't have that, I don't know where I would be now.
Today I'm here to look at ways that we can continue to improve access to cancer care, and the challenges that provides is really why I'm here.
Today I'm here because of palliative care. If it wasn't for palliative care, I wouldn't be at home. And I'm really, really thankful for this foundation. It's given me something to live for in the end. Yeah.